Can you tell us about talking therapies, which now seem to be very popular in the West and are now becoming very attractive to clients?
Yes, I think in a way it's popular because people don't like medicines. They feel a bit frightened of swallowing a chemical. So they often, when you say, okay, we can do this or that, they will say, doctor, I think I will go for the non-medical option of talking therapy. However, having said that, the newer therapies are very effective. In fact, they are as effective as medicines. And then you might ask me, okay, why do we give medicines? Well, medicines are more convenient, and also most people can deliver it because the therapies or the talking therapies need specialized training. So a normal doctor may not be able to deliver this kind of therapy. So to access the therapists who are capable of delivering this therapy may not be that easy. So therefore, medicines will work. And also you can combine medicines with therapy, and sometimes that is more effective. So out of the therapies, there are a few identified therapies which are proven to be effective in depression. So running through the list, there are about four therapies. One is called problem-solving therapy, which is also a fairly simple one, which can be used by non-medical people. And then there's a therapy that was specifically developed for depression called interpersonal therapy, IPT. And then, of course, we have the most popular one and probably the best therapy called CBT for short, cognitive behavioral therapy developed by Aaron Beck. And that is the most widely used therapy for depression. Of course, now there are other therapies like behavioral activation therapy. And the latest is the third generation mindfulness based therapies like acceptance and commitment therapy or ACT. These also can be used quite effectively. So there's quite a range of therapies available which the patient or the person affected can choose from. However, the problem is the therapist have to be qualified in these therapies. You can't just go and do therapy without training. So to find a qualified therapist, so that may be a problem depending on where you are living.
And what duration are we thinking of? Is it the same as medication? Does it take a long time?
Uh, yeah, it will depend really. It will be longer than the well, actually not really. The therapies may take as long as the medicines. Usually, the treatment for depression, if it's your first episode, will be at least 6 months. Okay, 6 months, and the therapies also would probably last actually less than that. Maybe full course of cognitive therapy is about 20 weeks. 20 weeks. So that we are looking at yeah, something like yeah,
Months.
little less than 6 months. However, it depends. If you respond very quickly and you grasp the principles quickly, you might even respond in a shorter period of time. So well, I've seen some patients responding in 3 sessions or 4 sessions, and they go on to improve even without any follow-up. However, sometimes we combine as well, and that can be also a useful strategy.
Do you encounter patients where the patient prefers talking therapy, but as a clinician, you find that medication might be more effective or is the more suitable option for a particular patient?
Yes, I think it depends on the severity of the depression. So, if I get a person who is very severely depressed and has perhaps ideas of suicide and has a lot of amotivation and lethargy, they cannot participate in psychotherapy because to participate effectively in psychotherapy, you need to have a certain level of energy and a certain level of concentration. If that is not there and that is impaired by the depressive disorder, we cannot start therapy. So I will, in that case, first treat with medicines and then later offer the therapy.